For us, the most important benefit of COC and NAPBC accreditation really has been a method of programmatic approach to cancer. Before we were a small rural hospital that did some cancer rurally and a lot of urban collaboration actually, but it wasn't enough. Now, we still had the worst mortality rates in our state after a decade, and it's because our approach to care was really what I call reactive care. And so when we looked at the COC process, we realized that the COC manual really is I call it a survival manual. It allows us to address all aspects of the needed components of proactive care, from screening to prevention to navigation to oncology social workers to treatments, et cetera, et cetera. And so for us, that's been a huge part of developing a process. My advice to small programs is you're never too small to consider being accredited as a cancer program. In fact, that was one of the first questions we asked is, do we have enough volume? And the answer we got is, if you treat any patients, you are a candidate for accreditation as long as you follow the standards. And so I would recommend that any program, no matter what their size, no matter what their geography, that wants to do better would benefit from this process. So, I would recommend a couple of things to do in that process. I would recommend that you either affiliate or talk to programs that have done this well. So if you want to talk to programs like small rural programs that have gone through the process and find ideas of ways to do better, I think that's approach. The COC, as you know, is looking at ways to invite more collaboration for programs. So that might be things like becoming rural affiliates with larger programs like NCI designated cancer programs. The University of Kentucky at Marquis Cancer Center has a great affiliation network that they do in Kentucky. Similarly, Iowa has an Iowa cancer affiliation network that is really helping address some of those disparities that we see in rural America. So I would highly recommend that if you're considering this, especially as a smaller program, discuss it with larger programs in your region and figure out ways to either collaborate or affiliate if that's possible.